Welcome to The Explainer. Today, we're going to transform some highly detailed anatomical source material into a dynamic guide of one of the absolute most fascinating, overworked, and intricate structures in your entire body. We're talking about the temporomandibular joint, or TMJ for short. But let's start with a simple question. Put your fingers right in front of your ears right now and just open and close your mouth. Feel that? Maybe you even hear a subtle clicking sound. Well, that tiny little movement is going to guide our entire exploration today as we unpack exactly what is happening inside that joint. Here is our roadmap for today. We'll meet the jaw joint, break down its core components, map out the surrounding nerves and blood vessels, look at the actual mechanics of chewing, explore what happens when things go wrong, and finally, touch on healing. Let's dive right in. Part 1. Meet your jaw joint. It's tucked right there on the side of the skull. The condyle of the lower jaw slots perfectly into the temporal bone, sitting dangerously close to your ear canal. Honestly, it's a remarkably tight fit for a joint that is literally almost constantly in motion. Moving on to part 2, the core anatomical components. Let's build this machine. The real star of the show here is the articular disc. You can think of this as a highly specialized, heavy-duty brake pad made of fibrocartilage. It sits right inside the joint space, basically acting as a shock absorber to stop any harsh, painful bone-on-bone friction while you eat, speak, or yawn. And it's perfectly contoured for the job. You've got a thicker posterior band at the back, a super thin intermediate zone right in the middle, and an anterior band sitting just above the lateral pterygoid muscle. That specific shape is exactly what lets it absorb shock from so many different directions. But to keep this whole rig from simply flying apart under the immense force of your bite, we rely on 4 heavy-duty safety straps. The joint capsule, along with the lateral, sphenomandibular, and stylomandibular ligaments, firmly lock the entire joint together while somehow still allowing for incredibly fluid movement. Part 3. Nerves, blood, and neighbors. The TMJ's crowded real estate. The source material goes heavy on the details here, giving us an exhaustive list of anatomical relations. But the main takeaway, this joint is packed in tight. On literally all 6 sides, top, bottom, front, back, inside and out, it is completely boxed in by crucial glands, vital nerves, and major blood vessels. Just look at what's directly behind it. You've got the superficial temporal vein and artery squeezed right back there alongside the parotid gland. There is virtually zero wasted space, meaning if your TMJ gets inflamed, it's definitely going to bump into those sensitive neighbors. Drop down just below the joint, and the plumbing gets even more intense. The massive external carotid artery routes right through here, running next to the incredibly powerful masseter muscles wrapping around the lower jaw. This close proximity is exactly why severe jaw tension can easily radiate and feel like a throbbing headache or intense neck pain. And check out the wiring. You have the main trunk of the mandibular nerve and the critical auriculotemporal nerve passing right through the immediate area. It's an entire network of biological electrical cables routed directly through and around this one tiny, overworked hinge. Part 4. The mechanics of chewing. Seeing the machine in motion. Mechanically, the jaw essentially operates on 2 contrasting sets of gears. First, you have elevation and depression, which is quite simply opening and closing the jaw. Contrast that with protrusion and retraction, which is the forward and backward sliding motion. Combining those specific motions together is what actually lets you grind down food. So what's actually shifting these gears? The heavy lifting of closing your mouth, or elevation, is powered by the temporalis and masseter muscles. Opening it, or depression, is actually mostly just gravity, helped along by the digastric and geniohyoid muscles pulling downward. It's a beautifully choreographed muscular dance. Part 5. When things go wrong. Clinical anatomy. Because let's face it, when a biomechanical system is this complex and used this heavily, things are bound to break down. Let's look at the specific vulnerabilities that lead to serious jaw pain. Take a classic joint dislocation, for example. The mandibular condyle slips entirely past the articular eminence. It basically gets stuck way too far forward. Fixing this requires a manual reduction, which literally means physically pressing the jaw downward and backward to pop that condyle safely back into its socket. And returning to that little test from the very beginning, here is the true culprit behind that clicking sound. The articular disc can actually slip out of place, snapping back as the jaw opens and closes.
That physical snap of the fibrocartilage, that is exactly the popping you feel and hear. Finally, part 6, healing the jaw. Let's look at the broader context.
It's worth noting that this rigorous anatomical breakdown comes directly from a presentation at the University College of Homeopathy. It serves as a great reminder that studying classical foundational anatomy is absolutely universal across all different medical disciplines. Because when you are treating a joint surrounded by such a chaotic web of nerves and blood vessels, every practitioner relies on this exact same structural map. Whether a therapy utilizes an allopathic approach or homeopathic remedies, truly understanding these precise mechanics is the non-negotiable first step to safely healing it. So, as we wrap up this explainer, I'll leave you with this to chew on. Considering its insanely complex mechanics, the massive muscles attached to it, and the highly crowded, sensitive neighborhood it lives in, how much stress is your jaw joint absorbing right this second? Give it some thought the next time you're stuck in traffic clenching your teeth or taking a giant bite of an apple. Thanks for exploring the science with me, and keep questioning how your amazing body works.